This was a randomized phase 2 trial of a novel combination of mosunetuzumab, a bispecific CD20, CD3 directed antibody, in combination with polatuzumab vedotin, which is an antibody drug conjugate. Patients were randomized to the control arm, which included rituximab with polatuzumab vedotin. So it was essentially Mosun Pola versus rituximab Pola. And this was a phase 2 trial for patients with previously treated diffuse large B-cell lymphoma, trying to determine whether the change from rituximab to mosunetuzumab would provide additional benefit to patients. Sure. So this was a randomized trial. So 40 patients were assigned to the control arm with rituximab polatuzumab, and 40 to mosunetuzumab with polatuzumab. So these patients received a bispecific T-cell directed T-cell engaging therapy in combination with the antibody drug conjugate. So in this study, patients were enrolled after a median of 2 to 3 lines of treatment, and it was a median of 2 in Mosun Pola and 3 in rituximab Pola. Some of these patients were heavily pretreated with prior CAR T-cell therapy, and about a third of them, and most of these patients were refractory to their CAR T-cell therapy. Half of patients were also primary refractory to their initial treatment, and some of them had very early relapse. The results were very encouraging. We saw a total response rate of 77% in the experimental arm in comparison with 50% in the rituximab Pola, and the rate of complete responses was 57%. What was also very encouraging was that these responses were durable among patients who achieved complete response. Over 80%, 82% remaining at complete response after 1 year of follow-up. Altogether, if we look at the results of survival with progression-free survival and overall survival, these are also very encouraging in comparison with other similar regimens and settings. With progression-free survival at 1 year now at 64%, and overall survival of 74% for these patients who were previously refractory to their therapy. What stands out really among similar trials is the safety of this regimen. Clinicians are quite accustomed to delivering polatuzumab, and mosunetuzumab appears to not only provide additional benefit, but also is quite safe, with only 10% rate of cytokine release syndrome, which was almost exclusively grade 1 and very easily manageable. These results led to a global phase 3 trial now, which compares the mosunetuzumab and polatuzumab vedotin compared to standard chemotherapy with rituximab and GemOx. But the principal significance of this is that this is a novel regimen for patients with previously treated disease, which is not directly compared to other options that exist, like CAR T cells. Or other bispecific-based combinations, but really stands out in terms of its safety and the durability of responses. So we think that this regimen may be a really good option for settings, community settings, smaller hospitals, or generally settings where more intense therapies are not available. And it may not require any hospitalization for patients. So we think this is a great option that will be developed as a potential highly effective, really with comparable efficacy to all other existing modalities, treatment for patients in settings where this would be the safest regimen to deliver.